Right, so good afternoon, everyone. As I mentioned, I'm the one with the red glasses. I'm Yvette Rowe. And before we start proceedings, I just want to acknowledge and show respect to the sovereign lands on which I'm standing on. I'm here at Gurrumilla, Darwin, on the sovereign lands of the Larrakia people, enjoying a wonderful dry season. It's a bit smoky this morning, and but yeah, it's going to start heating up soon. So I want to acknowledge the traditional lands that we're on. I want to acknowledge elders past and present. I want to acknowledge other First Nations people in the presentation, but also our non-Indigenous allies that have really supported the work of the Molly Centre. And I think it's and also acknowledge that this work has come. Sue and I stand on the shoulders and the hard work of strong women and strong allies who've come before us. I guess the people, I know that Sue Mac tried her hardest. I'm a Yingana Y.Roe woman, so both my parents on the top right-hand side. My dad is from the saltwater of Broome, and my mum is from the freshwater of Derby, which is about 240 kilometres. And then we have a historical, my grandparents brought their sons to Darwin in the late 50s, so we have a historical connection to Darwin. So and unfortunately luckily to go back there at the beginning of last year. So, I've got a very rich history of always going back to the Kimberley and always have a strong identity as being a sovereign Yingana Y.Roe woman. So I've got, I come from two amazing people who had very different opportunities to what I have, and I stand on the shoulders of, my parents and my grandparents who have really fought to improve where First Nations people are going. Underneath that is my, one of the things that I am really proud of. I'm the mother of two children, my daughter Jai and my son Max. I think they'll be my legacy in the sense of the greatest pleasure of being a mother and watch them turn into really wonderful grown adults. And just the pictures on the left-hand side is the beautiful white sands of Cable Beach of the saltwater. And underneath that is the iconic baobab trees, just the silhouette at sunset. And this morning I got up to go for a run, and in front of me was again, on the sovereign lands of the Larrakia people, looking over the sovereign waters of the Timor Ocean. And I've been really fortunate that most of my career and growing up has been in the far north. Also, people know me as a mad Richmond supporter, and we're going into the finals this year. Over to you, Kildea.
Thanks, Yvette. So my name's Sue, for those of you who don't know me. I am standing here today, or sitting actually, on the Central Arundel lands, the most beautiful lands of Central Australia in Mbatwa, Alice Springs. I was born in Ngunnawal country in Canberra and decided that was just far too cold, and slowly over my career and my life, I've sort of moved mostly and lived into the north of Australia where it's much warmer. You can see this slide here that throughout my career I started life as a nurse and worked quite a lot as a remote area nurse. And if you can see that little photo next to me with the white veil on when I was graduating as a nurse, it's a remote area where I had a little kangaroo that, of course, I'm on the phone to the vet trying to get advice. So the sort of things that you do in remote area clinics. I realised very early on that I wanted to work in remote areas, and to do that I needed to do two things, and that was to go off and study midwifery and to go off and get some emergency skills. So I did my intensive care training and my midwifery training, and then was able to go and work over in the Kimberley, which is where Yvette's from, for the Royal Flying Doctor Service. But it was really in Maningrida where I spent most of my time over the years and have left a large chunk of my heart. And there's a photo down the bottom there of myself and Molly laughing. That was in Sydney, actually. She was very cold. We were both very cold, laughing together. And she's a woman that I have to say has taught me an enormous amount throughout my career, and it is her that we have named the Molly Centre after. That was with permission from her family, some of whom are in the top right-hand photo there at one of the screenings of the Jackamere in Darwin. But I've also got there a photo of two other mentors of mine, midwifery mentors, and that's Leslie Barclay and Pat Brodie. And any midwives in the room would know both of these two extraordinary women who have been amazing for me in my life and provided incredible mentorship, and still do today. So that's me. And the long journey to becoming sort of, I only ever did midwifery really so I could work for the Flying Doctors, but over the years it turned me into a crazy midwife. And it was actually through my relationship with Molly that my midwifery heart became even stronger. So Molly has now passed away, and her family were really honoured to have a centre named after her. She was an extraordinary person. She was one of the founders of the Malabar Health Board, which is now the Malala Health Centre in Maningrida. She was a midwife, and she'd learnt both the Ballender, the Whitefellow way, and the Aboriginal way of midwifery. And she laughed and said that, you know, whenever she was helping women, supporting women to have babies, if she was in the clinic, she'd do it the Ballender way, but if she was in the camp, she would always do it the Aboriginal way, which she preferred and thought was a much smarter way of having babies, instead of sort of sitting up on a bed with, you know, the way that it was done in the clinics those days, lying down on your back. She was a scholar and an activist, involved for a very long time in actually making sure people in the community worked in a culturally safe way. And she was very generous with her knowledge of sharing how her culture worked. She was hysterically funny at times, always joking, and had a wicked sense of humour, often speaking at various events, always talking about the importance of not only being born on your land and your country, but being able to die on your country as well. So it is her that has inspired the Molly Centre. Over to you.
And I think one of the good fortune or the privilege that we have is to recognise, as I was saying in the beginning, is that we stand on the shoulders of women who have been advocating birth rights, human rights, and passing rights for a long time. And as for me, research is my activism, and it's a way of changing the narrative about how we do research, the questions we're asked, and things like that, and how we go about it. So when we think about the vision, the Molly Centre is really clear, and we've really tried to align it with the vision of Molly and herself, and also the ladies that you'll hear about later on. And the vision's in front of you there. And it's not just to do work that's good enough. It's to be leaders and to ensure that the work that we're doing is going to make an impact and make a difference. And we realise that we can't do everything about maternal and child health. So we're really clear we're going to work as tirelessly as we can for up to 2,000 days, because we're committed to the ideas that in that period of time, we think we can change life trajectory. And Sue's going to talk later on about, the statistics, which I'm sure most of people know, but it's always a good reminder about, why we wake up every morning to do the work we do. So being world leaders and to be national leaders is, striving for that is one thing, but it's also how you do that work. And social justice is critical to address the inequities that we see by First Nations women, whether that be in an urban setting, a regional setting, remote and very remote. We want to pave the way that all First Nation women and families can have the best start to life. It's not about politics of a geography. It's about when we all move together, no one gets left behind.
So I don't want to talk a lot about the statistics, but I think we need to be reminded, to be honest, about why our work is as important as it is. And this slide here has got the latest stats for mums and bubs in Australia. And the little yellow rates are the non-First Nations Australian women. The black is the Australian First Nations women, and the red is the Northern Territory stats. Now, this could potentially be similar for any remote area, but certainly the Northern Territory, where so many women have geographical live in very geographically challenging and remote distances. And you can see that for all of our key indicators, things are usually almost twice as bad for our First Nations Australians, and almost 3 times for those who live in the Northern Territory or remote Australia. And the important thing about this is that many of these are preventable. And if we can actually prevent those those first 3, the babies being born too small, the babies being born too early, and the babies that are passing away before they are born or in the first month of life, then we impact everything. We impact infant mortality, child mortality, life expectancy, educational outcomes. So really a lot of the work that we want to do is focused on that very first year of life, and before pregnancy. And we know we can make a difference. So the policy context that we're working within in Australia is, I always say, I don't think we've got a problem with policy in Australia. I think we've got great policies. Our problem is implementation of policies. So it doesn't matter whether you pick up the National Aboriginal Health Plan, our maternity policy documents, the 3 documents that have been written about birthing on country, or the characteristics of culturally safe care, any document, state or territory documents as well. We'll talk a lot about what it is that we want to see in our maternity services that are going to change those statistics around. But in particular, we look a lot at the birthing on country policy documents. And that's one of those things that it's one of those phrases that gets confused quite a lot. People think you're talking about having a baby under a tree in the outback with no skilled providers, but that's not what it's about. It's about remembering that for every single baby that's born in Australia today is born on Aboriginal country, on Aboriginal land. This land was never ceded. And the important work that's going to be happening with, the voice to Parliament and the referendum that's coming up is a really important opportunity for us to recognise that, but also putting what we know into action. A birthing on country service is a service that is very evidence-based. It's underpinned by the things that we know will make a difference to the health of mums and bubs. So we're talking about integrated, holistic and culturally appropriate care. And it's not just the clinical care, it's the social and emotional care, the cultural care that provides a holistic model of care. And it's the work that we do is called, it's like applied health services research, and it's about trying to get these policies into action and working with our community partners that are wanting to work to establish their own birthing on country services, to set up their exemplar models. We work in a participatory action research approach to work side by side on the ground to make things happen and to improve them. And this work is, it's slow, it takes a long time. Even when you've done the first study, you have to keep doing more and more studies. Luckily, in Australia, midwifery, a lot led by Leslie Barclay, and then ongoing the people that she's trained up. A lot of us have been able to attract NHMRC funding, to look at the evidence, to generate the evidence, to run the big randomized control trials, to build the evidence that shows that really we know exactly what components need to go into a birthing on country service if we're going to make a difference for Aboriginal and Torres Strait Islander babies across the country. And we were actually recognised recently by the NHMRC as they have done a case study on the trajectory of the different studies and the time that it takes over all of those years to actually slowly start turning a system around. So we're talking about massive system reform and system redesign so that we can actually change. It's a bit like trying to move the Titanic, really, I feel sometimes, but that's what we're trying to do when we talk about redesigning services. So, so where does the Molly Centre fit in all of that? Over to you, Yvette.
I guess, this snapshot is what Sue was saying, is a reflection of bringing a whole range of people, expertise, and building on outstanding work, as previously mentioned by Emeritus Professor Barclay and other researchers, to think about how are we like a spear, the pointy end that's going to sort of cut through some of the hard structural barriers in front of us. So what's in front of you today is, from a little centre 3 years ago, I think, as you can see there, we've hit way above our weight. When we think about the amount of money that we've brought into the institution in the last 3 years, there's a total of almost 38 million. The amount of research outputs, which is really important to the university system. We know the university is a big machinery, and there's certain indicators that they need to be competitive and receive grants. And we've got Lancet publications, excuse me, we've got research reports, conference publications. Because one of the things about being a researcher, I often describe myself, well, as a researcher, my job is to be a storyteller. And there's no good doing deadly research if nobody knows about it. So research outputs is really important, but they've got to be meaningful. When I joined the team with Sue and Yu Gao and Sophie and Jai and Sarah and Kayla, there was a very small team of 6 to 8 people who are dedicated. So to go from that to where we are now, we are, again, got greater opportunities, but also what we've been able to do is recruit staff that are really passionate about the work that we're doing. And we know that what you'll hear in front of us to present today is a result of a cumulative effort of amazing work by very talented people, and that we know we're fortunate to have and recruit and support them on their academic journey. And so I did mention, we do, if I round it up to $38 million, people will think, wow, that's a lot of money. But I want you to think about the amount of complexities to actually dismantle a health system that has resulted in outstandingly poor health results. So $38 million in the amount, and we're going to go through the projects that we work through, it's actually not a lot of money. And excuse me, I've got a bit of a cough. But what we know, with what we've done so far, and we've got to build on it, is that we can actually change life trajectory. We've been able to work with our partners to present solid, robust evidence to say that the young fellow on the left and the young fellow on the right can actually have the similar life outcomes if we redesign a system that is clinically and culturally safe. So one of the key instruments that we use is the RISE people might have heard of this before, the RISE implementation framework. And one of the things that we're clear about is that if we need to present research in a way that's really underpinned, that is genuinely underpinned by Aboriginal values, ways of being, ways of knowing, and ways of that really centres on those key principles. So the RISE framework sits there, and as you can see, it's underpinned by cultural values, connection and importance of country, how we understand that the world to be through our dreaming, and laws and protocols. And that it underpins how we relate to people and the ceremonial practices that the way that we do research, and understanding the relationship of how we do our research. So again, we've got here the RISE framework. R is for redesigning the health service. How do we invest in the workforce, both First Nation and non-First Nation? We know there's amazingly strong people in our communities, but some of our families need support. So how do we strengthen the capacity of families that might say, I need some help? And what we know is the evidence tells us that when you have community-controlled health services and community engagement, it actually makes a difference. So that's the framework that we position all our work. And sort of things like, oh, so what does that mean and how do we operationalise that? So often this diagram's much easier to sort of to see where we're going. So again, if I look across the R about redesigning health services, if we look at the current phase that we are, which is, say, our starting phase in any service, it's about where you're starting at. So often in most communities, those communities receive routine care in a community hospital. Where we want to aspire to and where we're heading is if we look at phase 4, we want integrated services, we want a hub, we want a birth centre. What's key to that is that we want mothers, babies and families to have a choice of birthplace. We know that for a lot of our women in our community, that choice is taken away from them. When we look at the investing in the workforce, currently, if we start again at phase 0, in a lot of places, there's no First Nation identified positions. And they work with a limited cultural understanding of how to work with First Nations people. Where do we want to be? We want to be at phase 4, where we have a clinically and culturally exceptional workforce. We don't want our people to be traumatised and hurt by structural racism. We don't want them to feel that they're unsafe, that they don't feel comfortable there, that the quality of their care is dependent on their cultural background or the colour of their skin. And we know that happens in the system now. The S is about strengthening the family capacities. We know that a lot of our communities are under stress for a whole suite of reasons. But where do we want to go? We want strong, resilient families where you've got things like language revitalisation programs, where we could be talking to young mothers or young families about their choice in contraception or pregnancy or where they'd like to birth, about how we bring elders into supporting families. Also about how do we ensure that we can protect our families from the distress of their child being removed. So we know that's a really complex area. And as I was saying before, the evidence behind embedding community control and engagement and governance is critical. We know that the ownership of First Nations services is critical to community activation, community ownership and community direction. So when we operationalise that, so that's the characteristics that we need to where we want to go. So phase 4 is what we would, I guess, the gold medal standard where we want to be heading.
And so how do we go about that? And what have we done with all of that money that came through the doors? Well, you don't do anything by yourselves in this game. It's all about working with partners, and it's all about working with other researchers across Australia who are also doing an extraordinary amount of things. And that's what Centre for Research Excellence funding is all about. It's actually bringing together people that are working in the same area as you and supporting projects to link people together and to keep with that vision very front and centre, but to support these different projects and increasing relationships and increasing not only the your national reach, but your international reach. And we've got colleagues who we're working closely with. They're working in a similar field to us. We're not doing what they're doing exactly, but their work overlaps, like say Professor Kath Chamberlain down in Victoria. Her work is very closely aligned with what we're doing, and we're working, she's a key member of our Centre for Research Excellence. There's a DADS program there, which is really important work. We've also got work there where we're doing, we're talking about major redesign, but what does that mean if you can't actually prove whether it's actually, there's cost benefit in what you're doing? So a major part of our work is around the work that's being led by Yu Gao and her team around the cost benefit analysis. And we've got costings associated with just about every study that we're doing. So that's just a bit of an example of the Centre for Research Excellence and the projects that we've got there. And I'm just going to give you a snapshot of some of our key projects that are in the field of supporting the birthing on country and this best start to life. And one of them who many of you may have heard about is the Indigenous Birthing in an Urban Setting study. And this was an evaluation framework that was put around the Birthing in Our Community program, which is a program that was set up in Southeast Queensland by the Institute for Urban Indigenous Health, the Aboriginal and Torres Strait Islander Community Health Service in Brisbane, and the Mater Hospital. And their partnership led to a significant redesign of services. And we provided the research team to evaluate those services over time. And the key components of the service, it was really about putting the policy of what, a birthing on country service might look like into action. And it was about trying to redesign the service with more Indigenous control. It was about really supporting the workforce so that they were culturally safe, clinically exceptional, but also that there was enough services to grow the First Nations workforce and wrap around those mums and those babies to make sure that they had the best chance in life. The care was really well coordinated, particularly once we moved into a centralised hub, the Salisbury hub, which was managed by the Institute for Urban Indigenous Health. And one of the other key things, of course, is the 24/7 continuity of care from a known midwife, which was, a core part of that and the First Nations workforce working together to support the mums. The outcomes have been published. We've got 2 Lancet articles. There's more than, I think, 15 articles already on this project and more coming. But the outcomes were really quite extraordinary. In the first couple of years, we saw a 50% reduction in preterm birth, which sort of averaged out to about a 38% reduction. I don't know of anything like that internationally. Like, it is extraordinary. And it's been sustainable, which is amazing. But there were many other outcomes. And if you walk into the Salisbury hub and see, we went from sort of about 2 full-time equivalent First Nations staff in the service to 18. So it's just got the most beautiful feel, and women feel at home and have told us so the minute they walk through the doors. So that's one of the key studies that we're doing. The impact there, if universities, it's all about proving impact. Like, was the research investment worth it? Well, hardly anything can say this. I think 22 preterm births avoided. So a really extraordinary outcome. Many other impacts, of course, because of the social determinants of health, where we saw women making their way through from a family support worker all the way up to the managers of the mums and bubs across southeast Queensland. We saw our 2 community researchers who we're so proud of still working with us today, and one's gone on to do ongoing learning and is enrolled now in social work, and another one is also just about to finish her MBA. So incredible things that really came out of this study. And what we tried to do next was we wanted to replicate it. So we wanted to test replication. And whenever you've got something that works really well, an intervention that works well, it's really important that you see, okay, can we try that again? Can this be rolled out or scaled out across Australia? So we designed the Boost study, and that was about taking the findings and the learnings from the IBIS study, but building on them. So the Aboriginal community controlled health services wanted to be able to employ their own midwives. They wanted to run their own birth centres. Still more evidence-based components being put into the model, and that's what we wanted to do. So that was being done in Brisbane North, a second urban setting, and a rural setting, working with UENH again, and working with Waminda South Coast Aboriginal Corporation down near Illawarra Shoalhaven on Yuin country. And this project's been one of those projects that's had a lot of challenges with the devastating fires that were there in the region, the floods that followed the fires, the COVID that followed that. And all through that time, the Waminda organisation have continued to be incredibly determined. And their goal in their strategic plan when we first met them was to establish their own birth centre. And it was just tremendous to see with the election, a commitment to $22 million for infrastructure for their Centre for Birthing Excellence down there in Yuan country. So what this project did find, of course, is IUE also were able to scale out, and there's lots of learnings there, and we're currently evaluating the 2 services. But we also saw that there were lots of structural barriers that are actually, unless there's something done about them, they're going to prevent ongoing scale up of this amazing intervention. So a lot of our work in the Boost project has been trying to actually do something about the structural barriers, and we'll talk a little bit more about them, but it's some of those are the technical and legislative and regulation barriers that stop midwives who are employed by Aboriginal community controlled health organisations being able to access insurance. No insurance for out of hospital births, so that's a home birth or well, we're not sure about the birth centre births, but we think that there should be insurance for that. But we think that they're going to have to establish private hospitals to be able to do that, which just seems ludicrous. But that's kind of our crazy intersection of legislation and regulation in Australia at the moment. So we've been doing a lot of work with our partner organisations to try and lobby for changes there, and we're still doing that. And certainly part of that is trying to get the recommendations for Medicare for midwives fully implemented from the review and the report that was tabled in 2018. We're still waiting for full implementation of those recommendations. So that's the Boost project. So just about to finish this year, but there's plans to continue on. But one of the other projects that we wanted to highlight is the Caring for Mum on Country project. And these 2 deadly women here, Dr. Sarah Ireland and Associate Professor Larapa Mapalama, are 2 of our team at the Molly Centre, and are the most extraordinary duo with big vision and doing amazing things. And you might have seen the Jackamere movie, which is a documentary of their work. And if you have, you'll understand a bit more about what it is that they're doing. But this project started a few years ago, and part of the work that they've been doing is translating the RISE framework into the local language in Galawinku, a little island in northeast Arnhem Land. And we were happy to say that it translated really well, and it sounds like it's going to provide a really good framework moving forwards. They developed a reproductive health literacy approach, which is also that little, you can see the pandanus mat there that's in the corner, and that's really a way of guiding the work and showing the way that these 2 have managed to do is integrate the 2 knowledge systems in a very respectful way to come up with new knowledge that's guiding the work of the Jackamere and the very, very big redesign work that they're doing in Galawinku, with the community wanting to recommence birthing services there in the very near future, and have a whole workforce of Indigenous women who are basically providing care for the mothers and the babies across that first 2,000 days. And you can see sorry, I think I'm one step behind with the slides. It's because it's different on this slide as to what it is over there. And you can see from the map there that what we've done is we've actually gone back to the history and gone back to see what's happened back in the early 1940s and the 60s and the 80s, when there were birthing services in the island. And we don't want to go back and do exactly what was there before. It wasn't sustainable and it wasn't necessarily the best. But what we want to do is reopen the birthing services to ensure that they're safe and provide better services for the mums and bubs on the island. And there's a photo there of Pat, who's our videographer, who's works very, very closely with Larapa and has been doing some amazing work with the team up there. The work is ongoing now. Luckily, we've had last year another NHMRC, which is going to progress the next phase of the work, and that's called To Be Born Upon a Bandanus Mat, and that's another 5-year project where we're aiming to redesign the services on the island, but also in Nhulunbuy and Darwin, where women have to travel for birth. So over this period of time, Larapa has been very clear with us that she wants birthing services re-established on the island. So we're looking at the moment at the capability framework that's needed, the workforce that's needed. We're using the RISE framework to inform the way we move forward. And we've got a very strong, which has been set up by Sarah and Larapa, a very strong research backbone committee that is from the Y.Roe organisation on the island that are guiding the work that we're doing. One other project that we've got that's helping these sites is another MRFF project, which is, and this one's called Birthing on Country Rise Safely in Rural, Remote and Very Remote Australia. And for this project, we're looking at supporting ongoing support for Wominda as the rural exemplar service. Gallowinku is the very remote exemplar, and we're working here in Alice Springs with Congress Alukra for the new service that they want to establish as part of the remote exemplar service, Birthing on Country service, or Best Start to Life service. So those are some of the key projects the Molly Centre's got up and running. The 3 things that we concentrate on as a research centre are research, of course, but support and evaluations are the 2 other things that we do. And part of a big part of our team and our work is the National Support Service for the Australian Nurse Family Partnership Project, which is a project that now is working in about 15 sites across Australia, 15 different Aboriginal communities across Australia. And we provide, under the leadership of Sue Krusky and Professor Sue Krusky and Associate Professor Sandy Campbell, we provide the National Support Service, the data monitoring, the education, the evaluation support for the sites. So that's another exciting project that we won the tender for in the early years of the Molly Centre. We do conduct evaluations with our partners. So if our partners, Wominda, had 2 programs that were quite extraordinary programs, and they requested some evaluations. One was of a young women's program that's run in the community, and the other was of a program that's for chronic disease. Both of them really are very holistic programs that are basically looking at the whole person in the way that Wominda works, which is one of the most extraordinary organisations I've ever worked with in the way that they provide services for their communities. So that's the other part of what we do at the Molly Centre. And then, of course, we've got to be careful that we do everything that, do lots of work, but if you don't, in research, if you don't publish, they say you perish. So it's important for us to do our journal articles, to do our reports, to make sure that with every journal article, we've got our specialist Sarah Maidman, who's working on community reports. And it's about getting the news out there so that people understand what it is that we're doing and how we're doing it. And part of that is the non-traditional research that we do, the great we, I'm really talking about Larapa and Sarah here, and the team in the large team that they work with in Gallowinku. This amazing documentary that they've done has now won awards in multiple places overseas, multiple film festivals, which is extraordinary, and been seen by many people in Australia. It's not yet been released for overseas, but it's already seeing quite a lot of people have seen it in Australia, which is great. And we're seeing some great outputs that are not your traditional sort of, do a research paper, get a publication, everybody's going to read about our research. This is actually a much more interesting way of communicating your research to the world. So back over to Yvette.
I guess in the sense, and so that's the stuff that we do and what we've got funding for. And I guess it's to sort of cast our sort of thinking forward to the next 5 or 10 years. And in front of you is a birthing tree, the one on the left, which is a very ancient birthing tree that First Nations women in Victoria would birth at. And I know there was a very big campaign, a public campaign, because there was a move to actually cut them down. And then we've got to the right, we've got these little seedling things where we're starting to see green shoots. And going back to the RISE framework, remember that our job is to ensure that the current system, which is an imposed Western biomedical system, doesn't crush what we know as traditional knowledges, but also it actually works. So we've got some challenges and opportunities. And again, as I was saying before, the work that we do is about social justice, but also ensuring that the community is driving our research agenda, that we bring expertise to the table, but it's only there to tell and support the community of where they'd like to take the research, and also the process, that the methodology or the methods on how we do that research. So if we think about where the centre's heading, universities are very competitive and they can be very cutthroat, but we feel we've got partners that are really committed. We know that our passion lies with the community, and for us, research is about a transformative, reiterative process that allows First Nation communities, especially with a focus on women and babies, to be at the table setting the agenda. One of the things is that we think, oh yes, in Australia we know that we've got partners and people are interested. Late last year, we actually, led by Dr. Sophie Hickey, did a paper that we wrote with colleagues internationally from New Zealand and from Canada, leading Indigenous scholars and allies, who said actually we need a call for action. And again, it was the stuff of the similarities between colonised settler communities that have very institutional and oppressive system that actually killing and hurting our community. So we had a call for action, and as the title of the paper says, a call for action that cannot go to voicemail. Research activism to urgently improve Indigenous perinatal health and well-being. As I sort of mentioned before, for me and my personal commitment to research that's what research is about. It's about activism, it's about disrupting the normative, and it's about redesigning to ensure that it reflects the aspirations of First Nation women. So we really sort of tailored the paper that there's things that you can do as an individual, there's things that you can do as a service provider, there's things that you can do as a policy and funding person, but everybody can make a contribution to it. Again, where's all this research leading to? Accelerate, adapt, redesign, and replicate. When we talk about urgently, the urgency behind this thing, we are striving to ensure that the next First Nation baby born is born healthy. But we know there's lots of things against us, but that's not going to stop us doing our work. We need stuff to do now, and we need immediate resourcing. We've worked really hard, and research is only one funding body. We need policy reform, and we need big buckets of money of infrastructure to make a significant difference. We need to make sure that research translation occurs, that it's just not publishing and writing up the results. That result is actually leading to policy reform, and people get it. Systems are built on structures which are really hard to move. So one of our key focuses is how do we remove those systemic structural barriers? And it's like there's multiple parts of this thing. You move one thing and you get a reaction from another. So we need to actually dismantle the system and redesign it that actually supports and wraps its arm around our First Nation women. And why are we trying to do it? Is because we want equitable outcomes so babies can have the best start in life. And we know that we've had structures that have been imposed on our community, and we need to flip the narrative and be really action orientated, that it's community driven. As I sort of mentioned, dismantling systemic barriers. And we're going back to the RISE framework. What does it look like when we're talking about redesigning and reforming health services? Things like the MBS, Are they, can they provide the amount of the right funding for the services AMSs provide, Aboriginal Medical Services provide? Insurance. Do we have a workforce that can access hospitals and provide the care, both clinically and culturally, out of hospital births? And we need to provide more evidence about researching cost benefits. We're looking to provide some papers again on the IBIS study about, if we know that we've reduced preterm birth, we know there has to be some cost savings in the system somewhere. Workforce is the biggest investment by any agency. We know it takes up to 70% of your budget. So what we know is we've got to change the whole way that we look at our allies as non-First Nation colleagues, and also how do we grow, as Katzenham recently released in their report, how do we grow and we graduate First Nation nurses, midwives, doulas, jackameers, allied health to work with our people. We need, and Katzenham has been, I think, a shining light on how we could go forward with that. Key areas regarding, strengthening family capacity. We know the removal of children is in crisis in this country. Reducing, child removal, but also having a system that protects mother and babies rather than traumatises by removing children unnecessarily. And as I was mentioning, community governance and control is critical. Although we've provided the outcomes about the reduction of preterm birth, we understand what are those mechanisms of why this happened. So we can ensure that in that unique place in Southeast Queensland, how can we replicate that to Nowra or to Gallawinku or to Alice Springs? Because we know that every community has its unique circumstances. So there's outcomes, but how do we get those unique outcomes in Southeast Queensland? Next one. Sue and I are talking about, the Molly Centre, like it's been here 50 years. It's been here 3 years. And so we have a long-term vision of where we could go. But we know that, we're in very uncertain times. So how do we have a sustainable research centre that's focused on that first 2,000 days, that when that issue is considered, everything's an issue. But actually, what we know is if we can change that first 1,000 days, we can actually change life trajectory. So we know that at the end of the day, we've got university needs that we have to comply with, otherwise we don't become an institute. But more importantly, we've got community needs that we've got to make sure that our research reflects and upholds the way we do it, reflects their needs. We need to generate sustainable funding. One thing that the team often laughs about, in 2021, we counted that we had written something like 15 grant applications. So we go through this cycle of, we want to do research, but we're going through this cycle of writing grants. Do we get them? Some we get, some we don't. And it just becomes this sort of production line of grant writing. So trying to get money to do the work is really important. So we've got to be able to look at all the options available, but not just as a money thing, but ensuring that our contribution is making a difference. What does it look like? I mean, we need, the next wave of students to come through that's going to hold this legacy to go forward, that's going to, do the work that the women were asking for, about that vision, about social justice, about the first state. HDR students are critical, because if we give them the right training, hopefully they'll stay here, but also hopefully they'll make a contribution in their broader career. Research matters if it's going to make an impact. If it doesn't, we need to be doing something else. But if it's only working in partnership that we make sure that we can make sure that it is going to make a difference. We know that we have to play the game about publications, but we also can be smarter. We've seen the impact of the Jackamere documentary. We've seen the impact that radio interviews could do. So one of the things we know is that we can be clever with that, but also takes time and resources. So we need other allies to be supporting the cause of improving the situation for our mothers and babies. Over to you, Kildea.
So we've got a big team of people. Nothing happens without a team, really, and everybody within that team has got a really special role. We don't have photos of everyone in our team, but there was a couple that we've got there, and I don't want to point out any particular person because every single person has got a really important role in our team. And you can see from the map there that we've got people working in quite a lot of sites across Australia, and pretty amazing really for 3 years of the Molly Centre. So big shout out to our team of staff and students. And our students are really important. They're a key part of what Yvette was just saying going forward. I don't have all of the photos of all of the students, but we managed to get a couple up there. And a big shout out to those that are our HDR students. Or we also like to support our staff who are doing their own studies going forward as well. And that might not be through high degree research, but it might, like with Sarah, it might be for social work. So whatever it is that's important to our staff, it's important that we continue that always learning, always growing, and always supporting each other to do that. And for those of you around Australia, if you're interested in hearing more about what it is that we do, we've got a big national conference in October in 2022 here in the beautiful Central Arundel lands of Central Australia. And we are showcasing some of the work of our incredible partners at this conference. We're using the RISE framework to structure the 2.5-3 days. And it's the website down the bottom there, the Best Start to Life. If you Google Best Start to Life conference, it'll come up anyway. If you haven't got your tickets, you better move quite fast because I believe we're getting close to selling out, which is really exciting. So that's it from us. If there's any questions at all, we're happy to answer them. And I will just take the slide down.
Thank you so much, Yvette and Sue. That was just fantastic. I get blown away every time I hear you speak about the work that you're doing and we're all doing. It's just been a huge undertaking and just congratulations. I wanted to see if anyone has any questions.
I haven't followed the chat. Were there any in the chat that we need to go back to, or was there anything at all? We're happy to chat about anything. Yvette is really happy to answer any questions anyone's got, despite the fact that she's got a bit of a croaky voice at the moment. And if there's no questions, of course, that means that we all get an early mark. No comments.
Anybody?
No questions?
I think for me, the Molly Centre and as a First Nations researcher is our team does this with, no one came to us with a script and said, oh, this is how you do it. Due to, again, mentoring and, well, let's just give this a go and let's have a shot at this and let's put this grant in and let's try and do a whole range of things. We've sort of got to this point. I mean, we need to acknowledge the previous dean of the college, Kathy, who made an initial investment. But what you can see is that the investment has come, back to the university more than expected. But every day that our team, again, this is a collective effort. Every day that our students are working hard on becoming outstanding scholars. Our staff are trying to, are learning and supporting, whether it's the ANFPP sites or whether it's Frida, our young cadet who's learning to work in a research institute, or Kayla, who's graduating her MBA this year, Dr. Sophie Hickey, who's student support. This is our organisation is we're trying to be strategic. We're actually very passionate, but we also know that research makes a difference. And and at the end of the day, I remember a conversation I had with Larapa on Monday, which is, come on, we've got to go quicker. And in the light of the urgency, we do have to work hard because, again, those statistics are actually, to me personally, and a criminal act where the state government has failed to support our communities. And unless we do something urgently to redesign, to get additional resources, and ensure that First Nations voices are at the centre of that drive, we will be having this discussion in 10 years' time. So I'm really fortunate that every day I'm accountable to the aspirations of those women that have gone before me.
I think we spent a lot of time talking about how hard it is and the structural barriers and the things that are making it really difficult. But I think in 3 years, we've had a 6-fold return on investment, which is pretty extraordinary. And it just shows what universities could be doing, investing up front in research centres like this, that are applied research centres that actually are working closely with partners on the ground who want to see changes in their community. And we are the ones that provide the research framework and the data monitoring, the data collection, the ethics and all of those sort of things, so that we can actually tell their story in a way that they want to be able to tell their story, and where they have more control of telling their story as well. But to be able to actually change things in a real life impact on the ground is something that I think the whole team at the Molly Centre need to be very proud of. But it's not just us, it's all our partners, it's the people that we're working with, it's the collaborators that work with us. So, you walk into a hospital and not all hospitals want to change what they're doing. A lot of them actually are very comfortable and very happy doing exactly what they're doing. Thank you very much. But the ones that actually, I was at the MARTA when the MARTA first went, yeah, we want to do things differently. And they were happy to be taken on a journey that was an extraordinary journey at the end of the day, and not something that anyone knew. None of us knew what was going to happen because of the action research approach, plan, act, reflect, go backwards 2 steps, go forwards 2 steps, go back 5 steps, and then start again because it didn't work, sort of thing. So, they were willing to come on board and do that. And that's what we're seeing in all of the workplaces that we're working with, is we've got Aboriginal organisations that are absolutely leading the way and wanting to make a change. But there's also the government and non-government, non-Indigenous organisations that are saying, this is really important to us too. We're there with you, working side by side, and show us how to do it. We'll do it with you, but we're not doing it for you, and we're not doing it to you, and we're not doing it on you. We are working side by side. So I think on that note, our time is up. Our time is up. So thank you all very much for coming. And Yvette, thank you in particular, given you've got that croaky voice at the moment. You did great. So thanks, everyone. And we'll see you again next time for the next CRE seminar series. Keep an eye on the website.
Thanks, Sue and Yvette. That was great.